All right, so hello everybody and welcome to Doctors for the Environment's webinar, Fossil Fuels Are a Health Hazard. My name is Dr Kate Wylie. I'm a GP and I'm the Executive Director of Doctors for the Environment Australia, and it's my very great pleasure to be facilitating this event this evening where we will look at the health hazards that are fossil fuels and what we can do to treat them. I acknowledge that we meet today on stolen land. The nation we call Australia is stolen. First Nations people have never ceded their sovereignty of their land, and respect and repatriation is owed. I am on Kaurna land, and hello to a group in Ghana is Namani. So Namani. And I think it's a sign of respect if people write the name of the land that they're on in the chat. I'd also like to acknowledge that we live in a time of climate emergency and that the decisions that we make this decade will have impacts on the health of our communities for decades, if not centuries to come. So tonight's webinar, we are going to be looking at how fossil fuels, coal, oil, and gas are health hazards. I'm very excited to be joined by three guests who are going to talk about one of the three big ways that fossil fuels are health hazards each. So first, I'd like to introduce Dr. Aditya Vyas, who is going to talk about how climate change impacts health. Hello, Adi, how are you going?
Okay, thanks for having me.
Thanks for being here. Our second speaker is Dr. Louise Woodward, who's a paediatrician from Darwin, who's going to talk about the pollution from extraction and processing of fossil fuels, especially in light of the Middle Arm project and fracking and our concerns around that. Hello, Louise. Welcome. How are you?
Hi, Kate. Thank you. Yeah, glad to be a part of this webinar. I'm speaking from Larrakia country.
Thank you, Louise. And then our third speaker is Dr. Mitchell Hexon, who is a sexual health registrar and is chair of DEA's new SIG pollution and plastic and waste pollution. Sorry, Mitch, I got it a little bit wrong. And he's going to talk to us about how plastics are not only clogging our oceans, they're also clogging our arteries. So welcome, Mitch. How are you?
Thank you. Thanks, Kate. I'm doing well, and thanks for including me in today's talk. I'm looking forward to it.
That's great. And then at the end, I'm going to do 10 minutes on a treatment plan for these health hazards before leading a discussion with our three guests and then opening up to the floor for questions. Before we start, let's just do some housekeeping. Obviously, this webinar is being recorded, so please be on mute. It will be posted onto our DEA Facebook website and onto YouTube, but when we post, you can only see the speaker view. When it comes to questions at the end, I'll be turning the recording off and we can have a free-flowing discussion. Also, for any GPs here who want to get your CPD points, I'll post the evaluation form into the chat and please fill that out. I need you to do that if you want to get your points. All right, that's enough from me. Let's hand over to Adi, who's going to give us 10 minutes on what is obviously a very massive topic on the health impacts of climate change. Thanks, Adi.
Many thanks, Kate. It's wonderful to be here, I think, on a momentous occasion where DEA is leading this new campaign on fossil fuels are a health hazard. So it is really a delight to be here. I'm speaking here from Gadigal land of the Eora Nation, and I'd like to pay my respects to elders past, present and emerging, and recognising that I myself have been a great beneficiary of First Nations leadership and welcoming as well. So folks, 10 minutes from me on the health impacts of climate change. I'm a public health physician by training, spent the better part of a decade at the New South Wales Ministry of Health, thinking through a number of environmental hazards, and the next two speakers will be talking about some specific hazards. I also have a new position now as the Deputy Director and Associate Professor of the HEAL Centre. Many of you might know the Healthy Environments and Lives NHMRC large fund that came out 2 or 3 years ago, specifically to address climate change and health. This is where I'm from, and on a good day, it's a beautiful place. Just to the north of the Harbour Bridge in Sydney, we have the Ministry of Health. And when most people ask me where I'm from and what I do, this is what I pointed to. However, in 2019-20, over the summer, before the pandemic was even a reality, we had bushfires. Significant bushfires, And I think I could just pretty much end my talk here. The experience was real. Everyone knew someone up and down the coast, either second degree or third degree, who had been impacted, and it impacted our work. This slide just encapsulates all of the direct and indirect health impacts from climate change. We have direct impacts, trauma and injury to health. We have indirect impacts from smoke, bushfire, smoke inhalation, poor air pollution, which has impacts on cardiovascular and respiratory health. But we also see something else, a couple of other things. Displacement of entire communities and destruction of the ecosystem services, as they're described in the literature, on which human health depends. It also disrupted health services. So one of the very first bushfires in New South Wales happened across the road from Port Macquarie Base Hospital. And for those who might be familiar, the hospital is built on a highway. Across the road from a highway is a forest. However, that forest is a peat forest. There's a large source of fossil fuels right across the road from the hospital. And it was the anaesthetist who called us when we were sitting in the ministry in Sydney. And they said, the air pollution indoors is worse than outdoors. And so surgeries had to be cancelled. But it was also broader than that. It was also other agencies, other parts of society, not just the community, of course, that was affected, but the Rural Fire Service, who were unable, with all of their technology, unable to put out the source of the fire, no matter how much water they put into the peat fire source. So humans have a hubris. We think technology will save us, and we think we're good at managing our environment, but perhaps not. And we also, I just want to remind ourselves, we should be mindful of our own neighborhood, our regional neighborhood in this planet. This is an image from Fiji, where I spent several months this time last year working on their Health National Adaptation Plan for climate change. And you can see the devastation brought by a cyclone in 2015. These towns, several of these towns, and several of the 210 health facilities in this tropical island nation have still not been rebuilt since that time. So these are sobering realities. I think we know the sobering realities, so let's turn briefly to the science. This is a really elegant paper from Haynes and Eby, and I know this will be familiar to many of you, but let's just set the scene for ourselves. It's clear, undisputable, that climate change is caused by fossil fuel extraction and burning and usage. We see this at the top left of this slide. Those rising temperatures cause rising sea levels and increasing extreme weather events, as the last two images showed us. But when we put this in a scientific framing from an environmental health perspective in particular, that discipline talks about exposure pathways, not just the human body systems, respiratory disease, cardiovascular disease, infectious disease, and so forth, that we're used to in our clinical settings for patient management and treatment, but the pathways of exposure that actually lead to those conditions, which you see here represented at the bottom of the slide. This really important middle box talks about the mediating factors, so things that benefit but also cause harm in that pathway from what's happening to our environment through to our health systems. So there are some things that actually are protective factors, early warning systems, socioeconomic status. If you're better off, you might have better health, and you might have better health literacy, and you might be better informed and better aware of what to do. On the other hand, the geography may be against you. The baseline air and water quality that you were exposed to as a child or in utero might be against you. And I know some of our next speakers will speak to this. So those mediating demographic, socioeconomic, environmental factors are critical here. And that's what many of us are trying to address through our own work. Those exposure pathways are things like this. Extreme weather events we've covered. Heat stress is a major issue for our hot brown country, our continent. So heat-related illness comes to hospital, often not described in that way, and often there's deaths in the community. We're seeing changing patterns of waterborne diseases and vector-borne diseases. Many will think to the Japanese encephalitis virus outbreaks in several states in Australia last year, which were not normally expected to be. So these are the exposure pathways and the ways in which our health is affected by climate change. let's just take this now to what are some of the interventions. There's doom and gloom on the horizon. We see this in the red box here, the changes to the climate. We see this in the light blue box, the effects of climate change, extreme heat, air pollution, and so forth. However, those darker blue health impacts that we're trying to resolve are based on what you see on the right-hand side of this slide around some of the interventions and the strategies. We can all be a part of this. These are, Kate asked me to talk about silver bullets, which we'll come to later, I'm sure. But here are some of them. Better engaged communities, a preventative approach rather than a curative approach, and early warning systems are some of the approaches. Let me tell you. Let me tell you a bit about the Australian setting, because a lot of work has been put into this, and Australia has just completed its National Climate Risk Assessment, the first part of this process. On the left, you see what some of the top climate hazards are, both observed and projected for Australia. These should not surprise you, so I won't read them out. But on the right-hand side, this is quite interesting. A number of science experts, health experts, and others came together, climate scientists came together to identify certain hazard concern levels, both for population health as well as health services. And so you see across these 10 hazards, there are ratings. And the takeaway from this matrix here on the right-hand side is simple. If we project climate change out into the future, 30 years into the future, close to 100 years into the future, there is high concern essentially across all of the hazards that we face from the environment, which are due to climate change. Many of you will be familiar with the MJA Lancet Countdown, which I've had the pleasure of being a member of over the last year. The most recent report came out 2 months ago, roughly, and it might just be worth highlighting one or two of these examples of what exactly is happening, because we're getting very good at quantifying the health impacts of climate change. One of the two big findings this year was the displacement of people and economic losses have been worsening. So on the right-hand side, you see a slide. It's a graph of total insured losses due to extreme weather events over the years. And we thought the 2019-20 summer bushfire period was bad, with some $5 billion in damage, in insurance payments rather. However, the subsequent couple of years, in the last 2 years, 2021 and 2022, we had severe flooding just over the 4 eastern states, which saw insured losses even higher, closer to $7 billion. And in fact, it was the highest ever recorded. That financial figure, which many people look at, masks the human figures below. So that's what you see here in the bottom left image, where you see the number of people displaced in Australia due to weather-related conditions, and that has been growing over time. So migration, displacement is not a problem for someone else somewhere else in the world. It's a problem for us.
1 minute, Adi.
Thank you, Kate. The second and the last example I'll pull out from this climate and health assessment from the MJ Lancet Countdown is, without suggesting that we take everything into our own hands, because we can do things as individuals and some things as communities and larger bodies and groups, associations. But of the approximately 87,000 diet-related deaths in Australia in 2021, 50% were due to high red meat consumption and processed meat consumption and inadequate fruit and vegetable consumption. So imagine the correction of this imbalance, which would save lives and reduce the carbon footprint of food production. I'll stop there, but simply to say, as I end, that we have many of the solutions in our hands, but the health impacts of climate change are here, they're increasing, and I'll pause there. Thanks, Kate.
Thank you very much, Adi. That was a wonderful summary that really just grounded us all and gave us a beautiful worldview and showed us the human costs and the qualitative, quantitative stuff that we've got as well. Thank you. Thank you very much. Louise, if you'd like to start sharing your screen, please, and talk to us about your experiences and the whole problems with pollution.
Okay, can you guys see that?
Great.
So yeah, hello everyone. I recognise many of you from our trip to Canberra and around the place. So yeah, Kate just asked me to talk about what was going on in Northern Australia and particularly in the top end, and that involves gas. So I thought I'd talk to you about the health impacts of gas. Hang on. Except I can't change my slide. The direct health impacts of fossil fuel production occur due to contamination of air, water and soil all through the environment. I'm going to concentrate on air pollution today just because I've only got 10 minutes. So there is a lot of research that is building every year, which all points in the one direction, that the direct health impacts of fossil fuel production and burning are harmful to human health. And there's well over 3,000 really high quality papers, and I've just put up a really lovely compilation of evidence put together by Professor Melissa Haswell, Jacob Hegedus and Professor David Shearman, and it's a really wonderful compilation of all the latest research into the health impacts of the oil and gas industry, and I'd encourage you all to download it and have a look. It's really good for doing your research and advocacy. So in terms of how air pollution from fossil fuels affects our bodies. So it basically affects every organ in the body. So the acute impacts include lung disease, asthma, and that's really easy to understand and see when there's volatile organic compounds in the air that comes from these fossil fuel gas processing factories. It rises into the air and then combines with heat, humidity and sun to cause ground level ozone, or smog as everyone calls it. And this smog basically contains thousands of toxic chemicals, including carcinogens, teratogens, endocrine disruptors and other inflammatory toxins that impact every organ in the body. Pregnant women and their unborn babies are particularly vulnerable. Pregnant women have a much higher metabolic rate, and obviously growing embryos are also very sensitive to teratogens and other chemical contaminants in our environment. So we see congenital anomalies. There's a few specific ones, including gastroschisis and some congenital heart disease associated with fossil fuel air pollution. There's also low birth weight is an increasing effect for communities living near these facilities. Also stillbirth and preterm birth are known complications. In terms of paediatrics, I'm a paediatrician working in Darwin, and so children are very vulnerable to air pollution due to their higher respiratory rates. So they take in more of the pollution per body weight, so that affects every organ in the body, particularly asthma presentations are a really big one, and severity of asthma, and we're certainly seeing that a lot in Darwin, and it would have been seen with bushfires interstate as well, and this is due to PM 2.5 as well as ground level ozone. Air pollution also affects people with chronic health conditions and chronic disease. So if you've already got heart disease and you're exposed to air pollution, which causes further inflammation of your cardiovascular system, you're much more likely to have an early mortality due to cardiovascular disease. It exacerbates diabetes and other endocrine disorders. It can reduce cognitive function and cause early onset dementia type symptoms, and can also affect our immune system, lowering our immune system. And often these gas facilities and other fossil fuel projects are put into communities that already have poor health outcomes and lower socioeconomic status, because we call them, I guess, sacrifice zones. And certainly Darwin and the Northern Territory is very rapidly becoming Australia's sacrifice zone. Just going through, there's many great studies out there, but I just thought I'd point out to a few of them. So there's a really good study released in 2022 by Lee and co, which looked at more than 15 million Medicare beneficiaries in the United States and compared all-cause mortality to their proximity to oil and gas development. And it's a really lovely study if you want to go and have a look at it. Can you guys see these graphs? So basically, can you see my mouse? Yep, great. So you can see that their proximity to the oil and gas, the closer they are, the higher their mortality. And then you can also see they've done upwind and downwind. So if you're downwind of the gas facility, you have a higher all-cause mortality, but you also have a higher all-cause mortality if you're upwind. So that indicates other ways of other environmental contaminants, not just air pollution. So that's water pollution, soil, and other things. Oh, how do I? And then this is really lovely. They've shown that the populations prior to the arrival of the gas facility, you show a slightly higher than baseline level of all-cause mortality, and that may relate to the kind of lower socioeconomic status of many of these communities. But then you see the arrival of the gas industry, and you can see the all-cause mortality jumps up, and that is due to everything that I described before, including exacerbation of chronic disease as well as others. So the other thing is the cancer risk. So many of the chemicals associated with the gas industry are carcinogenic, and particularly what we're seeing at the moment is a rise in hematological malignancies. Now, what we worry about is that hematological malignancies occur more rapidly than other malignancies, so they present earlier, and this industry, particularly the LNG industry that Australia is such a big fan of, is only a new industry. It's only just started, and so we're not yet seeing the huge number of cases that we will be seeing in the future in Australia, but we are seeing them in the US. In the US, this is a really lovely meta-analysis of hematological malignancies occurring in residents living within 5 kilometres of petrochemical facilities. They also looked out to 10 kilometres. And this is looking at over 187,000 people. And as you can see here from the graph, leukemia is a significant increased risk for people living within 5 kilometres of these petrochemical factories. So it's up to 58% increased risk, an average of 30% increased risk You can see here non-Hodgkin's lymphoma is approaching significance, and it's probably just because it takes a little bit longer to develop. So we may see increasing significance with non-Hodgkin's lymphoma. The other ones are not significant. So yeah, ALL, which particularly occurs in kids, but this occurs in all age groups, are associated with petrochemical facilities. And lucky us in Darwin, we will be seeing a lot of petrochemical facilities, because that is the direction of the gas industry. Once they are unable to sell their gas for energy, they'll be switching over to petrochemicals.
That's 1 minute, please, Louise.
Okay, so big story. As you can see here, a case control study looking at the large fracking areas in Pennsylvania, showing an increased risk of ALL. And in the Northern Territory, our EPA has just approved fracking in the Beetaloo Basin this week. There's also higher cancer incidence of all sorts of cancers amongst petroleum industry workers, which we don't talk about nearly enough, as well as residents. And this is all sorts of different cancers. And then in terms of offshore petroleum production, which Australia is expanding rapidly, exposure to benzene and other carcinogens increase the risk of bladder cancer amongst the mostly male offshore petroleum workers. So yeah, there's lots more to say, but I'll wrap up there so that I don't go over time.
Oh, thank you, Louise. And, you know, all those things, it's so overwhelming and shocking to think that, you know, like, firstly, as Artie's, you know, outlined, we've got climate change, the greatest health problem facing humanity and all of its awful things. And then we've got just the toxicity of it, like the poisonous. It's poison, you know, and that we just accept it somehow seems quite crazy to me. And I'm sure to everybody else here as well. And I think Mitch is going to pick it up there, because there's a lot of craziness really when it comes to plastics, I think.
Yeah, thanks, Kate. I'll just share my screen. Give me 1 second. Great. Can everyone see that? Perfect. All right. Yes, I'm Mitch. I'm the new chair of the Plastic SIG, which is a SIG that we've just got started just recently. And I'm going to be talking about some of the health impacts of plastics. So just a little bit of boring stuff about plastics first. It's a long carbon chain, has some additives to it to give those plastics special qualities, like adding plasticizers to make it softer, more flexible, less brittle, or adding UV stabilizers or flame retardants to it. Plastics have been in manufacturing since about 1907, but they've really ramped up on an industrial scale since 1950. And they've really paved the way for the convenient lifestyle that we all have today as well. However, they've become extremely ubiquitous in all environments across the globe. And they have enabled extraordinary advances in medicine as well, from diagnostics, therapeutics to our modern day surgery too. However, all plastics that have been produced are probably still here, or in large part still here, and they take hundreds of, if not thousands of years to decompose, and they've only been manufactured for this in the last 70 years. So almost all plastic that's been manufactured is still here today. And we're only ramping up production as well. So in 1950, there was about 5 million tons of plastic produced, and now in 2024, there's around 550 million tons. And the fossil fuel companies only want to expand this industry further. So by 2040, they want to double the amount that's produced today, and in 2060, they're looking to triple the amount of plastic that's produced. And this is because of the green energy revolutions taking part, so they need to shift their profits to some other industry. And single-use plastic makes up about 40% of the plastic produced. But there are some common myths about plastic as well. They're often described as cheap and disposable. However, if you take away the subsidies, if you factor in the cost of disposing of these materials for hundreds of thousands of years, or burning them, or the carbon emissions associated with plastic, they should be 10 times more expensive than what we currently pay for our plastic. And they're also described as being recyclable, and plastic really isn't recyclable. Less than 10% of plastic produced is recycled. And this is a waste facility in Victoria, or a storage facility in Victoria. And this was some of the red cycle plastic that was stored there and ultimately ended up in landfill that you can see in the background of the slide. And plastic, in order to recycle plastic, it's actually more expensive than it is to dispose of in a landfill. And you end up with an inferior product. You're mixing pigments, you have to end up with a brown or black plastic at the end. It has very limited uses, and it gets contaminated with other inferior types of plastic or other materials too. So you end up with a B-grade plastic at the end. And we're told that they're inert and that they're safe. And we're beginning to learn now that plastics aren't as inert or safe as we once thought. Since 1950, there's been 9.2 billion tonnes or 9,200 million tonnes of plastic produced, 2/3 of which has been discarded either into landfill or our environment. Less than 10% has been incinerated, around 11% has been incinerated. Only about a quarter of it is still in use, and less than 10% has been recycled. And unfortunately, the growing trends with plastic and recycling are actually, we're becoming less efficient at recycling our plastic, or we're recycling less of our plastic. So now in 2023, we only recycled 4% of global plastic. We burnt 11%, and a quarter of our plastic was mismanaged, so ended up in either land or aquatic environments. And plastic also contributes to climate change. So 1.8 billion tonnes of greenhouse gases are produced from plastic production, which makes up about 3.4% of our global emissions. And if it was a country, it'd be the 6th biggest polluting country, just behind Russia and just in front of Germany. And those emissions are only expected to grow as the plastic industry is looking to expand. When we discard our plastic, it often starts off as macroplastics, and this clogs up our environments, clogs up our landfills, and also harms biodiversity. By 2050, with our current projections with plastic waste and disposal, our oceans will have a larger volume and weight of plastic in them than they will fish. And only 0.5% of our plastic ends up in the ocean. So such a small percentage of our plastic is in the ocean, but it's still going to have such a deleterious effect on our aquatic biodiversity. And at the moment, there's twice as much plastic in the world than there is animal biomass. And it has some of the impacts on our biodiversity. In particular, seabirds are adversely affected. So about 90% of birds are found to have plastic in them. Albatrosses, 100% of regurgitated material contained plastics. And now we're finding that seabirds are developing something called plasticosis, which is a fibrosis of the gastrointestinal system. And this was associated with a higher mortality rate in birds. However, our macroplastics rather are just the iceberg. Microplastics are this evolving field as more and more of the plastic that's been produced begins to degrade. We're being increasingly exposed to microplastics. Microplastics are very small fragments of plastic, less than 5 millimeters. You can get these through ingestion, through inhalation. You can also absorb them dermally. And we're beginning to find that they can be passed from mother to fetus as well. So there is congenital spread of microplastics too. So they're being found in placentas and umbilical cords. And they've almost been found in every organ in our body, and they've been found in our bloodstream as well. Each cup of coffee contains around 25,000 particles of microplastics. And the plastic tea bags have about 12 billion microplastic particles in a cup of tea. And yeah, some of the organs that we've been finding in blood, breast milk, placental tissue, and we think it might be getting through the blood-brain barrier as well. There was a study that examined mice and found that most mice contain microplastics in their brain, but we haven't had any human studies with this yet. In terms of health complications from microplastics, the initial studies were done in occupational exposure, where workers were being exposed to really high quantities or concentrations of microplastics. So in the 1950s, flock workers who were making insulation for houses out of nylon were being exposed to airborne particles. As you can see how dense the air was with microplastics in these facilities. And these people were 150 times more likely to develop pulmonary fibrosis than people in the neighboring communities. And we're also finding that in fence-line communities, as Louise touched on too, communities that live near plastic factories have higher rates of preterm birth, lower rates of lower birth weights at birth rather, higher childhood asthma and higher pediatric cancers like leukemia that Louise touched on as well. And I'm sure you're all, well, most of you are aware of its micro and nanoplastic study that was published in NEJM this year that looked at carotid plaque and examined it for micro and nanoplastics. So the study had 304 patients and it examined the carotid plaque and found that 60% of the plaque contained micro and nanoplastics, and then followed these patients up over 34 months and compared the group that had the micro and nanoplastics in the plaque compared to the group that did not. And it found out that over the 34 months, the group that had the micro and nanoplastics were 4.5 times more likely to have one of the primary endpoints, which was either a stroke, an MI, or all-cause mortality. Yep. However, microplastics are only one part of the health complications from plastics. There's also the additives that I mentioned earlier that can also have poor health outcomes as well. So these can be plasticizers, flame retardants, or pigments as well. And PFAs is sort of the big one, the one that's in the news at the moment. So PFAs were a commonly used chemical and still are in use today, although we're trying to wind them back. So they were used in Gore-Tex clothing, they were used in paint, pesticides, in microwave popcorn bags. They're used to prevent furniture and carpet from getting stains. They're used in non-stick fry pans, which is one of the first uses was in Teflon. And they're also used in firefighting foams as well and hygiene products. They're a carbon chain that has this ring of fluorine around them, and they're incredibly stable. It takes lightning and the energy generated from lightning to break these chemicals down, and they're ubiquitous. They're everywhere. They're in our clouds. They're in the deepest oceans, the Mariana Trench. They're in the highest peaks. They're in the snow. And when humans have been tested in America, 99.8% had PFAs in their serum. And they bioaccumulate as well. So they're in much higher concentrations in seafood. So particularly the higher up you move up the food chain, the more they bioaccumulate. And there hasn't really been any evidence to suggest that there is a healthy level of PFAs. Any level has been associated with health harms. And the US, they estimated that PFAs cost somewhere between $5 to $60 billion to the healthcare system. However, the health effects from PFAs are still being sort of disputed or teased out. And these chemicals can also be passed on from mother to child as well. So there's a generational component to these chemicals, and they can cause epigenetic changes too. So they can lead to alterations to the genome that can be passed on to our children as well. And they're in breast milk too. Thanks, Kate. So some of the health effects from PFAs that have been associated with a reduced vaccine response in children. We'll touch a little bit more on this on the next slide. Lower birth rates as well, dyslipidemia, altered liver functions. In firefighters, there was a significantly higher chance of kidney cancer, particularly when they were using the flame retardants. And there's been a higher risk of testicular cancer in firefighters and in military personnel as well that were exposed to high amounts of PFAs. In terms of the vaccine response, so this was in children aged 5 years. On the x-axis, you can see the concentration of PFAs, or in this case, PFOs, which is a type of PFA, and the antibody response that they had to the diphtheria vaccine. And there's a linear cause effect, as you can see. So as the higher the PFO concentration in the serum, they had less antibody response to the diphtheria vaccine. And this was similar to measles and in tetanus as well. PFAs have been in the news recently. They've been discovered in all water sources in Australia. There's a documentary coming out on Stan with Mark Ruffalo talking about how they're poisoning the planet with the production of these chemicals. And 3M, a company that was involved in the production of these and still is today, has just been fined $10.3 billion for contaminating the UK's water system with PFAs. And PFAs are only one endocrine disrupting chemical, one forever chemical that we're being exposed to. There are lots of others like phthalates and bisphenols. So the take-home message, our relationship with plastics is incredibly harmful. It's contributing to climate change. It harms our biodiversity. Microplastics are an evolving health concern, and we're only beginning to learn a bit about that, scratching the surface. we've got these endocrine disrupting chemicals that last in our environment probably forever, and they're a bit of a cautionary tale to unregulated industry. So thank you all. Thanks, Kate.
Oh, wow. Thank you, Mitch. That was
Sorry.
that's pretty sobering. I didn't know a lot of those things. I think that's much worse than I really appreciated. And I suppose that's the point, is that we're, developing our understanding. And the more we learn, the more kind of terrifying it is, actually.
Yeah,
like
absolutely.
It's pretty shocking.
Mm.
All right. Well, then I'm just going to if everyone could just indulge me for 5 minutes, and I'm going to talk a little bit about what we should do, in my opinion. How are we going to treat this massive health problem that we have? Because I think we've, established pretty well tonight that fossil fuels are health hazards, and that we should think of them as a health hazard, like we think of asbestos and like we think of smoking. We should think of them as being harmful to us as humans. And so the first thing really in my treatment plan is acknowledging the problem. I think there's a huge amount of denial in our communities around, certainly around climate change, certainly around pollution, and definitely around plastics. And so fundamentally at our core, we really need to acknowledge this. And I'm sure a lot of you are very aware of the concept of declaring a climate emergency. Many jurisdictions around the world, certainly in South Australia, both our upper and our lower house have declared, which is a good thing. Whether it really spurs people to action or not, I worry about that. But what I'm going to ask everybody in the room to do right now is internally, in your mind, declare a fossil fuel health emergency. So just say it to yourself. This is a little bit of crowd participation, but let's just acknowledge that for ourselves. Okay. So I know that's a little bit daggy, but I actually personally find that quite powerful, because it gives us time to stop and reflect of these 3 very excellent presentations that are pretty hard-hitting. But we need to, digest it. We need to understand that this is what's happening to us. The second thing we all need to do is stop making it worse. It's so obvious. And, this is a picture of a sticker that I got made up about 4 years ago, Stop Burning Fossil Fuels. And you may find this on a few toilet walls around Adelaide, certainly some bikes. But, listening to tonight's talk, I've had to change it to stop using fossil fuels, because it's not just the combustion, it's the exploration, it's the extraction, it's the processing, it's the using, and it's the disposal of fossil fuels, and it's the transforming them into plastics. All along the way, fossil fuels are dangerous to us. And so, we just have to get out of them. How are we going to do that is the biggest question. So today, DEA, we did this wonderful action, and pretty much everybody on this call, thank you for signing on to this. It was a really great thing. We were published today in the Australian with our open letter, Coal, Oil and Gas are Health Hazards, asking our Australian government to ban all new coal, oil and gas because of the health problems, because of global warming, because of pollution. And, you can go onto our website and find your name on our form, but, a lot of us are there. The other thing, of course, we need to do is we need to cease all fossil fuel subsidies. We have to stop supporting this malevolent, dangerous industry. How dare they take our taxpayers' dollars? We should be absolutely furious about it. But I think to get that to happen, what we actually need to do is remove the social license around fossil fuels. Unfortunately, we live in a world where, as Mitch talked about, plastics are so popular. They make our life so convenient. And driving ads, every time there's a TV show, what do you see? You see an ad for a car, or you see an ad for gas, and then you see MasterChef chefs saying, well, we're going to use renewable gas, the greenwashing. Terrible stuff. So what we need to do is make fossil fuels unsociable. And this is what we did as a health profession. This is what we did with smoking. Where 50 years ago, we used to smoke in hospitals. We used to smoke on planes. Smoking was absolutely normal, and now it's an unsociable thing to do because we know it's so bad for us. And so, let's do the same thing with fossil fuels. Let's prohibit fossil fuel advertising and sponsorship. And DEA has a position statement on that you can read. We're also doing some work in a couple of months with the Fossil Ad Bang group, who we're quite good friends with, so watch out for that because that'll be some fun action. Of course, we need to protect nature. We need to cease native forest logging and protect forests, because we know that, you know, they are our buffer against the harms of fossil fuels. They support biodiversity. They act as a carbon sink. And of course, we need to protect all our water sources, because without water, everything dies and we're in big trouble. So, of course, I know that these are big over the top, you know, dancing over the top things. And of course, we need to stop plastics, you know, and DEA will develop his position statement on that over the course of this year about where we go, because of course, in the health professions, we do use a lot of plastic. The third thing we need to do is prepare for our changed world. We know we need to adapt. We have warmed our planet by 1.1, 1.2 degrees. There's a whole heap of pollution in our air. There's a whole heap of plastics in our oceans and our bloodstreams, and so we do need to prepare. But the adaptation piece is a webinar in itself, and I'm not going to go into that. The point I want to make is that it's everybody's problem. You know, this is a systems issue, and it requires all parts of the system to act. And we absolutely 100% need policy change. We absolutely need political action. But we also need corporate responsibility. You know, we need our big industries, we need our big institutions, our medical colleges, our unions, all the big businesses who've got the power and in many cases the money to do something about it. We need them to act too. But I want to put a little shout out for individual action, because I think there's a false dichotomy around big action versus small action. I think top up and top down has to be both. And, you know, individuals can be powerful if they choose to be. So Greta Thunberg is one person and has had a massive effect on her world. Donald Trump, he's one person as well, and hasn't he had a massive effect? And, you know, all that any of us can do is our own self. You know, we only have agency over our own action. So I ask that we all consider our own actions when it comes to climate and fossil fuel action. And, you know, everybody here in this room thinks that. That's why you've turned up tonight. I've made a DAGI acronym. We are fated with being alive at the most important decade in human history. So F stands when it comes to individual action, F stands for finance. We can all take our money out of banks and financial institutions that invest in fossil fuels. We can all do that. Some of us can be involved in shareholder advocacy, where we try to change from within. We can all be involved in political action, and certainly we can all vote for climate action. You know, when we're in a ballot box, we can look down that list of names and think, which person here has the best climate policy, the best fossil fuel policy? Because really, that's what we need to save ourselves. We can all practice active transport. We all should do that as doctors and health professionals anyway, use our feet. We can buy electric cars. We can use public transport. We can all get our energy from renewables. Often that's as simple as switching in the bill. And we can all follow a plant-rich diet. And I think after hearing Mitch, we can also, you know, probably don't want to eat too much seafood anymore. But yeah, the big thing is political advocacy. We know that there'll be an election in Darwin in August. There'll be an election in Brisbane in October, one in Western Australia next February, and probably a federal election next May. DEA will be absolutely doing political campaigning, and we would very much love all of you to be involved. One thing you can do tonight, and I'll give you some time to take out your phone and scan that QR code, is write a letter to your MP regarding fossil fuels being health hazards. So the top bit is really what was in the paper today. And I'll post the link in the chat too, just in case we run out of time. But what was in the paper today. But please feel free to add your own words and vent your spleen and tell your elected representative who is elected to represent you what you think. Okay. Because fundamentally, you know, we're really, really up against it, you know, and there's so many things around us really putting a great strain on our health. There's big health hazards of coal, oil and gas, but have to leave on my favourite cheesy medical meme. You know, we are the antibodies kicking in as the planet fights its fever. So let's mount that immune response together and do everything we can to stop dirty fossil fuels. Okay, so I'm going to stop sharing there. And thank you, everybody, for being here and listening. I want to ask my three panelists a question that you almost always get asked at talks, and it's so reductionist, but I would hope that you can answer as broadly as you wish. And Adi, you can go first. And that is, if you could do one thing, what's your one thing? You could do one thing to save the planet. What would you do, Adi?
It's a no-brainer, and I'm so glad I'm going first. Keep the fossil fuels in the ground. Simple. Not so simple.
Yeah, simple solutions with complex answers or something, complex mechanisms to arrive at our simple solution. Exactly. What about you, Louise? What would you do?
Yeah, I'd like to say everyone here, many health professionals, our voices are actually quite loud and quite powerful, and you can add your voice to many of the climate campaigners, the environmental defenders in your communities, and that will make a powerful alliance. You can stand in solidarity with First Nations campaigners, and it's a really, really great partnership, and it's really empowering actually to stand in solidarity with others.
That's excellent. Absolutely. And, it's really, really important to remember, don't you think, that we're all in this together, and you get so much sucker from, being with other people that care. Certainly it supports me, keeps me from, falling into a crying ball in the corner. So I think that's really important. And Mitch, what's your one thing?
The one thing I would change is to have elected officials and a system that values the health and well-being of our population over profits. So that would be the one thing I would change.
Wouldn't that be nice? And I suppose that's why when we're standing in that ballot box next year, we vote for the person that actually has that. And, usually there is people there, there's community independence, there's certain parties that actually think this stuff too, and who are not captured by the fossil fuel industry. We need to vote them out. We need to reduce their influence on our political world, because basically they're peddling a health hazard. We've got to stop it. All right. Thank you, everybody, so very much. Thank you, Adi and Mitch and Louise, for your wonderful presentations. And I'm going to stop sharing now, stop recording. And then if anyone wants to just have a chat and ask some questions, let's do that. All right.